Have you been told by your doctor that your thyroid is fine, but you're still feeling tired or brain foggy? Maybe you're constipated and having issues with digestion. When you bring those issues to your doctor, they look at your labs and they say, everything looks normal. Welcome back to the RedRiver Health and Wellness channel, where I help you decode your blood work so that we can manage dis-ease from a root cause perspective. I'm Dr. Arts. Let's get started. I'm sure most of you are familiar with the value called TSH. Well, let's talk about what TSH is and what it isn't. TSH stands for thyroid stimulating hormone, and it's actually not a thyroid hormone at all. TSH is a brain hormone. It's released from your pituitary gland, and it tells your thyroid to produce something called T4 or thyroxine. You may notice that your medication says levothyroxine. That is just inactive thyroid hormone, also known as T4. That is exactly what your brain is stimulating your thyroid to produce. Now, your TSH value on your blood work may be showing as high or low. I want you to know that just because you have a high TSH actually doesn't mean that you have hypothyroidism. It's much more complicated than that. And if you have a low TSH, that doesn't mean you have hyperthyroidism either. Your brain will alter the amount of TSH that it gives to your thyroid based on the amount of thyroid hormone in circulation. What that means is if you need more extra thyroid hormone, your TSH is going to go up. That's your brain saying to your thyroid, hey, we need a little bit of extra. If you have something like Hashimoto's and you've actually destroyed thyroid tissue and your thyroid is having a hard time keeping up with production, your brain may yell, we need more thyroid hormone. And that's going to mean that your TSH looks so high on your blood work. Your thyroid may actually respond to that stimulation. It may not have an issue with that. Maybe it just needed a little extra motivation. That's why it's so important that we look at the downstream hormones and the effect of having that elevation in your TSH. We don't ever manage medication based on a TSH value because that value will go up and down based on your body's needs. But the TSH and T4 relationship is not the only one that we need to be looking at. Then we need to check in on how well is your body able to convert that T4 into its active form known as T3. T3 is the only hormone with binding capacity. It's the only one that can fit inside of thyroid receptors and cause the changes and stimulate the production that the cells it's binding to are looking for. Even just looking at a T4 value is never enough to evaluate whether you have enough active thyroid hormone in your system. We have to look at your body's ability to convert that T4 into T3, active thyroid hormone, and that can depend on quite a few factors. It's not enough to just look at TSH, and it's not enough to look at just T4. We've got to check all along the feedback loop. Now, there are a couple of other tests that are really important here. T4 can get converted into T3, but it can also get converted into something called reverse T3. Now, we see this happen more often than not in patients who have a lot of chronic stress. The body will actually convert T4 into reverse T3 as a protective mechanism. If most of your T4 went into T3 when your body is already kind of hyped up, you may actually experience hyperthyroid symptoms. The body doesn't want that to happen. It's always trying to maintain homeostasis, which again is why that TSH value can go up and down throughout the day, throughout the month, throughout the year. Your T4 to T3 conversion should look something like this. If your T4 is a 1.27, your T3 hormone should be somewhere around 127. Now, there's a difference between T3 and free T3, so I want to make sure that you note that here. When I'm talking about this one-to-one conversion, I'm talking about free T4 into total T3. Now, total T3 will get taken up by the tissues of your body, the cells of your organs, and it will get converted inside of the cell to free T3. This is one of the reasons why we don't often test free T3. And if your physician is looking at free T3 and not total T3, they're not getting the full picture. Free T3 is mostly inside of the cells of your organs. It's not in your blood. It's not something that we can accurately test for. Another really important value to be looking at is something called T3 uptake. T3 uptake is like an indirect measurement of how many receptors are available on your cells for T3 to bind to. There are things that can block those receptors, one of which being estrogen. and reverse T3. Estrogen is the most common hormone that can block T3 receptors. So again, this is why one of the reasons we don't just look at TSH or just look at T4 is because you can still have hypothyroid symptoms if something is blocking your receptors, but we would never know if we didn't test all along that feedback loop. So we want to look at TSH, free T4, total T3, reverse T3, and T3 uptake. If we're evaluating you for autoimmunity, which should be done anytime someone is looking at your thyroid, we want to look at things like thyroid peroxidase antibodies and thyroglobulin antibodies. Having an autoimmune thyroid condition can drastically affect the way that your body is able to manage thyroid hormone. So it is not as simple as giving you levothyroxine or even T3, something like Cytomel, if your body is having a hard time maintaining functionality. In other words, your immune condition has caused so much inflammation that we don't know which way is up anymore. And then we end up kind of chasing your lab values with your medication doses. What we have to do is we have to stabilize the system first, reduce the inflammation, and then kind of see what's left. It's the peeling back of the onion approach to medicine. If you only test TSH, it's like seeing the check engine light go on, but not actually looking at the engine. If your thyroid testing is incomplete, you may still be experiencing symptoms of something called subclinical hypothyroidism. And this is much more common than your physician would lead you to believe. Just because your doctor doesn't know how to appropriately test your thyroid doesn't mean that there aren't more appropriate tests to be doing. What I find often with physicians who are trying to manage a system that they don't specialize in is they're not really all that open to external advice, especially coming from the patient him or herself. So if you want to advocate for yourself, what I would suggest is you write down the whole hormone cascade that we've already spoken about today, bring those tests into your physician and ask them if they would be willing to run them. If they're not, that's usually a sign that you might want to find a better doctor. Remember, you deserve answers and you deserve to feel well. So don't settle for someone telling you that your blood work looks normal if you still feel fatigued and brain foggy and muscle achy and joint pain and all of those symptoms that can come along with having hypothyroidism. Make sure you advocate for yourself so that you can get the help that you need. So what is the functional approach to thyroid health? If we're not just looking at basic hormones, what are we doing to manage your thyroid? So first and foremost, we look at a very extensive thyroid panel so that we can get an idea of how that feedback loop is working or not working in your body. Then we have to consider the effects of being hypothyroid. What effect has being hypothyroid had on the rest of your system? This can have a drastic effect on your liver's ability to detoxify, create hormones, create cholesterol. It can have a drastic effect on your adrenal glands, your cortisol regulation, your other hormone regulation, things like estradiol, testosterone, progesterone. You can experience an issue with neurotransmission. It's one of the reasons why we get a lot of brain fog when we have hypothyroidism. We use a combination of diet, lifestyle, and supplements, as well as empowerment and education to manage your thyroid condition. Our goal is for you to be able to read your own blood work and advocate for yourself in the future so that you don't have to bounce around from doctor to doctor to get answers for the way that you're feeling. We also teach you how to recover from flares. This is mostly important for patients who have autoimmunity, and that way you can take care of yourself with the tools that you need beyond our care together. Your thyroid isn't just a gland. It's a gateway to feeling better in your body. Speaking of thyroid testing and advocating for yourself, I've created a free guide of all of those thyroid hormones that you should be asking for if you want really comprehensive testing. This guide includes all of the tests you need for a thorough thyroid assessment. But keep in mind, it's not looking at the rest of the body or the effects that having hypothyroidism long-term can have. Download this now using the link in the description. If you're tired of incomplete answers and you know that there must be a better way to managing your thyroid condition, RedRiver Health and Wellness can help. Our team specializes in advanced testing and personalized care to get you feeling back to yourself again. Click the link below to schedule your consultation today and to get to the root cause of your dis-ease. If you found this helpful, check out my next video where I go over all of the different types of thyroid medications and why you may not be on the right one. Click the video on the screen now. I want you to remember that your health and wellness are worth fighting for.